Welcome back to Diabetic Foot Files. I'm your host, Dr. G, and today we're going to talk about cinematic wound science. This is the wound science series. In the vast, untamed wilderness of 1823, a seasoned frontiersman named Hugh Glass was on a fur trading expedition when fate confronted him with I guess, one of the most savage survival stories of American history. This was played by Leonardo DiCaprio in the movie The Revenant, and Hugh Glass suffered near fatal injuries that challenged everything we know about human endurance, infection, primitive wound care. And tonight we're going to deep dive into what those wounds really were, how they were caused. Well, I mean, we pretty much know about the bear, right? How they became infected, how one man survived them without modern medicine, including the surprising role of maggots. So we're gonna deep dive into the Revenant, Hugh Glass, and who was portrayed in that movie by Leonardo DiCaprio, the amazing Leonardo DiCaprio. Definitely was one of my first crushes growing up. And who wasn't? Like how was he not anybody's first crush? Like any girl's first crush growing up. Like we all loved him. So let's dive into it. So the climatic scene of the bear, right? The bear mauling, okay? In The Revenant, the horror sequence in which Hugh Glass is attacked by a grizzly bear is one of the most visceral scenes in cinema, and it's grounded in historical events. So, what is the mechanism of injury for getting mauled by a grizzly bear in this movie? So, Hugh Glass was scouted for game when he startled a mother grizzly bear with its cubs, and that provoked a ferocious defense attack. And the grizzly bear pretty much charged at him, knocked him down to the ground, bit and ripped at his torso, arms, and legs, slashed his throat, ripped his scalp, and broke one of his legs. And these kind of injuries, as blunt plus penetrating trauma, massive force crushing bones, tearing muscles, and open wounds everywhere. In the film, his wounds were dramatized, like exposed ribs, deep lacerations, torn flesh, but they also captured the essence of it. He was grievously wounded from head to toe, pretty much. Grizzly bears can generate about greater than 1,000 psi fight force and massive blunt force from body weight because these bears are about 600 to 800 pounds plus, right? So the mauling mechanism of injury, blunt trauma, right? Blunt force trauma first. So he had thoracic compression, ribs fractures, pulmonary contusion, and possible pneumothorax. Then blunt trauma triggers tissue necrosis, of course, hematoma formation, and ischemia from vascular compression. These deep lacerations and avulsions, so the bare claws, because you know they are long, created shearing force, muscle fiber disruption, as well as fascial tearing, possible periosteal exposure. And from the wound classification standpoint, these are, I mean, open contaminated traumatic wounds, high bacterial loads, irregular wound edges, of course, devitalized tissue present. I mean, there's going to be multiple various types of debris inside these wounds because he's in the wilderness. And this is the perfect environment, I mean, for gas forming organisms, of course, anaerobic colonization, because you have to remember he's in the cold, right? And a lot of those things thrive, like very serious bacteria can thrive in the cold, and a polymicrobial infection. So, the neck trauma. So, in the film, Hugh Glass sustains a deep anterior neck laceration. So, these potential injuries can include a platysma violation. Sorry if I'm pronouncing it wrong. A tracheal involvement, a jugular vein risk, which is amazing that, oh, I don't even know how that didn't happen. A carotid artery proximity. So, if the carotid was severed, death would have been inevitable in minutes for him. So realistically, the wound must have avoided major vascular disruptions. So, when we get to the immediate trauma physiology, after catastrophic injury, the body enters something that we call shock cascade, the hemorrhagic shock cascade. So, the blood loss results in decrease in preload. There's a decrease in cardiac output. There is an increase, of course, of the sympathetic nervous system activation. There is a catecholamine surge of epinephrine and norepinephrine. There is peripheral vascular vasoconstriction. And what this does, it helps preserve brain perfusion and coronary perfusion, but it sacrifices the skin, the GI tract, and the peripheral tissue. And this prolonged shock results in lactic acidosis, mitochondrial dysfunction, cellular apoptosis, and if untreated, multi organ failure. So the fact that Hugh Glass survived means that major vessels were not catastrophically disrupted and bleeding was severe but not fatal. So let's talk about the wound contamination and the microbial ecology of it. So the infection and the threat of sepsis. So why infection was inevitable for this? Of course it was. This is also in a pre-antibiotic world with no sterile care. So this man is surrounded by dirt, forest, debris, animal saliva, animal nail debris, bacteria from the soil and water all entered into Hugh Glass's wounds. And without proper cleaning or antiseptic, infection would be most almost guaranteed. Okay, this man was injured. And even today, deep puncture wounds from animal attacks are considered high risk for infection. And the main killers for these are cellulitis, gangrene, and sepsis, which is blood-borne infection. So the bear saliva definitely contained gram-negative rods, gram-positive cocci, and anaerobes. The forest floor contamination contains, like, will add, of course, Clostridium species, Pseudomonas, soil fungi, environmental staphylococcus. Remember when people get that also any type of soil injuries, you think of tetanus too, right? Because it's dirty, right? So this creates a polymicrobial biofilm ecosystem. So the biofilm formation for these type of wounds are within hours. The bacteria adheres to the exposed collagen, and then the bacteria secretes this extracellular polymetric substance, EPS, and this forms the structured colonies and it helps the bacteria develop antibiotic resistant traits. The biofilm protects the bacteria from the immune cells, the phagocytosis that our bodies will do to try to eat the bad bacteria, and it protects the bacteria also from environmental stress. So that's why we care so much about biofilm formation and we try to get rid of it so much with debridement. But this person, I don't think he had the means of debridement. So without debridement, infection is inevitable. So why didn't this gentleman die of sepsis? So sepsis occurs when infection turns into immune dysregulation and it causes a cytokine storm. So the cytokines that are usually involved in things like this, we should all know this by now, TNF alpha, IL-1, IL-6, interferon gamma. So these triggers are causes vasodilation, capillary leak, hypotension, and coagulopathy. And this can lead to what we did an episode on is disseminated intravascular coagulation as well as multi-organ failure. So why did this gentleman survive? Hugh Glass. He was a young, healthy in man in elite physical condition. Okay. He was a frontiers man. So he was highly conditioned. He had a strong immune system and good baseline of cardiovascular reserve. And the natural debridement that he helped with infection that gets us to our number one game player when it comes to biological debridement, in my opinion. Everybody has their own point of view. Maggot therapy, okay? So you've heard the legends. Glass lay on a log and let the maggots eat the dead flesh on his wound. Is this truth or not? Yes, there is a real medical principle behind this. We already went through a whole episode about maggot therapy, which I love, but in a medical setting, maggots, fly larvae, right, were used. And still in specific settings, it helped clean infected wounds. They eat dead necrotic tissue. They do not eat healthy tissue. That's why you can't be like maggots can't just lay their eggs on healthy skin. Okay, like you have to have an open wound. Okay, and a wound that's like kind of well infected. There's dead tissue because they don't eat healthy tissue. Their digestive enzyme can reduce bacteria and they help stimulate granulation as well as wound cleaning. And in Hugh Glass case, there was no sterile care. So the maggots could reduce the dead infected flesh that could all otherwise cause and fuel gangrene and sepsis. So that raw environment effect may have actually helped him survive by slowing the spread of deep infections long enough for her immune system to fight back. I just feel like the universe, the Lord God Almighty was looking over him, to be honest, in my opinion. It wasn't just, I wouldn't say just luck, but it's all the circumstances for him to live is amazing, right? So maggot debridement therapy is real. Like I said, still used today. The larva, especially the blowfly larva, secretes proteolytic enzymes, collagenase, serine, protease, and trypsin-like enzymes. And these liquefy necrotic tissue, leave viable tissue intact, and reduce bacterial load. And the antimicrobial secretions by maggots, they produce allotonin, urea, which is amazing. I love me some urea, phenolactic acid, and then phenolactic acetyde. I'm not pronouncing that right, forgive me. And these substances increase the wound pH, inhibit bacterial growth, disrupt biofilm matrices, and they also stimulate the fibroblast migration, the granulation tissue formation, and so, ironically, the maggots may have prevented the gangrene, reduced the systemic bacterial spread, and lowered the sepsis risks for this patient. So nature pretty much took its course and performed his own surgical debridement on this man, which is amazing. So he also reportedly had a broken leg. Like this grizzly bear took him in, like did him for the worst. But thank God he was still alive. So he had a broken leg. So untreated fracture risk. What is some of the biggest risks for untreated fracture? One is a fat embolism. Next is compartment syndrome, which is kind of crazy how he didn't get that either. Osteomyelitis. This man must have been in pain like in incredible amount of pain. And if immobilized improperly or crudely, it reduces further vascular damage and allows callus formation, like bone callus formation. And the bone healing phases are hematoma formation, soft callus formation, hard callus formation, and then remodeling. So even without surgery, bone can heal if it's aligned. Even bone heals when it's not aligned well, but it will try its best to make a hematoma formation over it, and then the callus, the soft callus, hard callus, and then remodel along that area. So, how does someone like Hugh Glass survive in the wild with nearly every major trauma imaginable? So, primitive trauma care that might have been used. This man like was a real man, like a real human, like a survival human, right? He set the broken bones, most likely using crude tools like a stick, and created a splint. We all love in podiatry, y'all love us what we call it, a posterior splint to immobilize, keeps the bones ends from further damaging the tissue as well. A drain and clean the wound. So he might use wild water and debris removal. It's crazy how this man was able to do this by himself because there was no help. And letting nature and maggots remove the dead tissue, maintain hydration and nutrition, so sipping from the streams, eating berries and roots. But, these are old school survival men. They know exactly what to do, what to eat, and if lucky, raw meat or fish as protein sources. And like I said, on a disclaimer, this is just for medical, like my podcast, pretty much. Not for any medical advice for anybody. This is just for anybody to learn, not to take it into the real world, okay? Because if you're gonna do that, just don't even listen to this, okay? Because everybody should know better. Common sense, make it common, right? So warmth and shelter, so insulation with hides. I think he did do that, right? He hid in the hide of an animal, right? to keep him warm and a fire to prevent hypothermia. So Hugh Glass reportedly wrapped himself in a bear hide that was placed over him, essentially using it as a bedding and warmth. This man is I I know he would have been those people like I don't even know if modern anybody today could survive something like this because I feel like a lot of people pain tolerance is very, very low. So I don't know. Now, let's talk about the cold exposure as an antimicrobial aid. So, sub zero temperatures may have helped reduce the bacterial replication, slow the inflammatory cascade, and reduce the metabolic demand. Because, sometimes they say ices, especially when it comes to fractures, things like that. So, cold can paradoxically slow infection progress. Well, let's talk about the metabolic survival mode that his body probably was in. So, starvation physiology. So, what happens when you have starvation, right? There is a glycogen depletion, gl- gluconeogenesis happening, ketogenesis, and fat oxidation. And the stress hormones maintain survival. Stress hormones like cortisol, glucagon, catecholamines, and then prolonged stress increases the immune modulation and the risk of infection. And yet he survived likely because the infection remained localized, which is amazing, and no full systemic inflammatory response. So, when it comes to the historical accuracy of this movie, the real Hugh Glass was mauled in 1823 during a fur expedition. It is confirmed that he was left for dead, which is unrighteous. Like, but I understand other people needed to survive, right? But still, that sounds horrible. He crawled to over 200 miles, approximately 200 miles. This man crawled. That is beyond willpower, okay? And he survived. The things that were unconfirmed but widely reported is that he used maggots, and they also reported that he was being assisted by the Native Americans during the recovery. Hollywood dramatized a revenge plot and a son storyline, but the survival itself was very real. Glass didn't walk back. That man did not walk back. This man crawled. He crawled on his belly, hundreds of miles towards safety, around 200 to 300 miles. So let's approximate that 322 to 483 kilometers, which is crazy. So 6 weeks of brutal travel. Can anybody do that these days? No. Okay. People are complaining about waiting on the bus, waiting for the bus. Okay? People are so impatient these days. Our attention plan is so low. It's crazy. I don't think most people can survive this at all. Just at all. This man had everything, like we said, major trauma, which is crazy. This is an insanely prolonged journey against all odds that gives credence to the term revenant. It means someone who returns from the dead itself. That's where they got the term from. So, what are some of the wilderness wound care principles, if nothing is available, that he probably used? He probably stopped the bleeding, probably put direct pressure and elevation. He probably removed the debris. He allowed drainage, you know, of the open wounds because if you try to close wounds that are infected kill. That's why if you have a major infection, you are not supposed to stitch it closed, right? It's supposed to stay open for, secondary intention, right? Because you want to make sure that all the infection is gone. Because if you close it with infection in there, it's just going to fester and continue to spread. Okay. He most likely splinted his fracture. He stayed warm. He hydrated and avoided sealing the dirty wounds. And nature prioritizes drainage over cosmetic closure. Now, why does this case fascinate medicine? Because this story demonstrates immune re- resilience, natural debridement, biofilm biology, survival endocrinology, and primitive wound care management. So this is pretty much a masterclass in host pathogen interaction under extreme stress. So Hollywood versus history again. Like we said, he was a real frontiersman man who was mauled by a grizzly bear. He was abandoned and left for dead. He crawled back for weeks to safety. He used maggots, you know, to clean his flesh. Okay. And like we said, the son's murder and the emotional revenge did not happen. So this man is better than most people in every shape and form because he didn't even think about revenge. He just cared about surviving. So the remarkable combination of factors, the resilience, the natural wound debridement, and the sheer willpower. This isn't just sheer willpower, this is willpower at its max, okay? Likely kept him alive long enough to recover. And the story behind the movie The Revenant isn't just about cinematic cruelty, okay? Hugh Glass is an amazing man, and this is about trauma science, microbiology, biochemistry, and evolutionary survival. It forces us to ask how much of modern medicine is replacing what our body's biology already attempts to do itself. Huge Glass story, which, is filtered by Hollywood visuals, right? Is still a legendary not only because of the violence of the injuries he endured, but because he survived in an era where there was no modern medicine. He had open wounds, broken bones, infection risks, and days without food or shelter should have already killed him. Yet this frontier man taught himself how to use nature's own tools, including maggots, to keep an infection at bay and nurse himself back to life and crawled over 200 miles approximately, right? So survival in the wild isn't magic. It's about biology, grit, and willingness to fight with every tool available, even the ones that most people recoil from. And that's what I also tell patients. We have so many tools in our toolbox to help heal your wound. This is not the time to give up. And you have to ask yourself, how close was Hugh Glass to septic death? Probably inches. So I hope this episode was very helpful for everybody. And this is Diabetic Foot Files. I'm Dr. G, and take care of your feet because they take care of you.